Telehealth is sort of a broad term that covers all digital information and communication technologies that you manage healthcare with.
The uncertainty surrounding COVID-19 has heavily impacted our operations, I would say. It changed the way we conduct our appointments. We had to adjust and convert many of our appointments from in-person to telemedicine appointments.
The patient-physician relationship during an office visit is being transformed into a teleconference in order to help manage their healthcare remotely.
We are using telemedicine has been very beneficial for our operations. It has allowed us to continue to see our patients and continue with the clinic volume. It's dropped a little bit, but we were able to convert 80% of our appointments to telemedicine within a week to 2 week span.
And I can speak to psychiatry now. In just the last few weeks since the stay-at-home order, we're actually at the same number of patients we're seeing in person. In fact, just beginning to eclipse it. So what's kind of interesting to note is, we had an initial drop off there that first week because people were very scared to leave their homes and things like that. And of course, and rightly so, but we quickly adapted at UCR in offering telemedicine visits.
So it's come in really handy now because our patients are, as you know, we all have to stay at home, but it's important for our patients to still be seen. And there is a fair amount of anxiety about this, understandably so. And so our psychologists and psychiatrists have been pretty busy providing counseling services for our patients.
So what makes psychiatry ideal for telehealth is that most of our examination is spoken word. We listen to the patients, but we examine them, how they look, how they are responding, what their expressions are. There's very little, I would say that psychiatry is the least field of hands-on.
Our UCR Health physicians and our patients have responded, I think, in a positive way. They've been able to adjust in real time. COVID-19 came around very rapidly, and so our physicians and our staff have worked closely together to be able to implement workflows and tip sheets to help with our patients in converting those appointments to telemedicine. So I think, now they've gotten really comfortable with it, and it'd be interesting to see once COVID-19 is over, how we go back to, regular operations.
But I think this crisis has brought telehealth to the mainstream, and much of it will stay on after the crisis is over because patients, I think, will demand it.
I think this is a game changer. I think we're really going to look at this. There's been a movement to move toward telepsychiatry. In fact, we have some state funding to expand telepsychiatry, given the vastness of Riverside and San Bernardino County. So we wanted to expand telepsychiatry. This just put it on warp speed.
And for us at UCR Health, it actually allows us to create more capacity to take care of more patients. So I'm excited about where it's headed.